The month of May normally signals the start of the first wet season in Guyana. This year, the rains came early in April, much to the anticipation of the local farmers, who depend on this season to start sowing seeds. Unprecedented levels of rainfall resulted in flooding across the country. Back in December 2020, the Hydrometeorological Office forecast above normal rainfall for the May-June 2021 wet season, but not at these levels.
This year is actually unprecedented. It is an extreme occurrence.
The Civil Defense Commission first received the word of flooding on May 18 by monitoring social media sites and maintaining a 24-hour operation. Director General Lieutenant Colonel KESTER.
The first report we got for Region 9, and we conducted some assessment, established shelter, and as the situation gets worse, persons were issued with cleaning and sanitation hampers and food hampers.
Knowing that Region 9 is prone to seasonal floods, the CDC already had an actionable plan in place.
Even before there were reports of any major flood impacts in Region 9, we would have already deployed teams in the region, prepositioned food supplies, cleaning supplies, and other supplies in the region.
Since then, the CDC has been monitoring water levels and providing relief to affected households. Reports began to pour in about flooding in every region. Reports of flooded yards, houses being swept away, and the mining camps flattened. The disaster response agencies sprang into action, deploying teams in all 10 administrative regions.
The first thing, once you get information on the flood, is to conduct the assessment. So we conduct the assessment to really determine the extent of the flooding and the needs required. And once we have identified the needs required, we started to work closely with the regional administration to ensure that first and foremost they activated the Regional Emergency Operations Center and response mechanism, and they start to identify the areas that are significantly impacted and commence the distribution of relief supplies. There are instances where persons were displaced and shelters were activated and persons were evacuated to those shelters.
More than 53,000 households have collected hampers from the CDC. The Commission is responsible for procuring the items for distribution. The CDC is also working around the clock, packaging the food and the cleaning hampers. At the National Gymnasium, you will find more than 50 staff and volunteers working 14 hours each day to ensure no one affected by flooding is left without some form of relief.
My job or role predominantly is ensuring that the numbers, the paperwork, ensuring that each community receives what they're supposed to receive. I also is involved with looking over the ground, ensuring that what has to be packed is packed according to the criteria. I ensure that all the staff is being treated as per what is expected of them, and so forth.
The operation of the CDC is well coordinated. The agency has come into praises from Prime Minister, the Honorable Brigadier Retired Mark Phillips.
This is a well-oiled machinery at the CDC, and the operation to bring relief to the impacted communities, I'm satisfied with the effort, the total effort at this point in time.
Adding to its many duties, the CDC has established 9 shelters in regions 2, 5, 9, and 10, housing over 230 persons. The shelters are outfitted with the necessary sleeping and hygiene kits to provide some level of comfort to those displaced.
So you have to provide sleeping items for persons to sleep. So we provide cots, in some instances cots with mattresses or roll mats, health care, medical health care, cleaning supplies, food, and also female and men care, and if there are babies, we provide items for babies. So we take care for all the needs of persons in the shelter because we recognize it's a difficult time for people, and the least we can do is to ensure that all the needs are met.
Even though the CDC is not responsible for the management of shelters after establishing them, due to the lack of personnel, the agency's staff are working overtime in supervisory roles at the shelters. The Civil Defense Commission is also collaborating with a number of government agencies to ensure persons get the best relief. The coordinated work involves the clearing and the dredging of canals, pumping of water into main rivers, and the distribution of replanting material, among others.
There's coordination from the highest level in terms of working closely with the cabinet members, working closely with the Prime Minister, the President. There is coordinating level at the PS level, the head of agency. And one of the mechanisms that we have is what's called the National Emergency Operating Center. It's a 24-hour mechanism, alerting mechanism, coordinated mechanism, planning mechanism.
Though the Disaster Response Agency is executing its mandate with precision, it is currently operating with 50% of the required staff complement. This means the CDC is heavily dependent on volunteers, the Guyana People's Militia, and the reservists in the Guyana Defense Force to ensure those in need get timely assistance.
We augment our staff with volunteers, and we augment our staff with reserve officers from the Guyana Defense Force. Those augmentation are able to meet some of our needs and demands. And now I think we're packing over 2,000 hampers per day. We have to increase with more volunteers and personnel from the military. Some Rotary Club and Rotaract clubs and Lions Club and other NGOs are also supporting the work. So key in what we do is not only the staff at the Civil Defense Corporation with the responsibility, but we get support from other stakeholders.
Prime Minister Phillips gave the operation of the CDC a major boost when he fought in the National Assembly to secure additional sums to support its flood relief efforts. His firm stance is responsible for the passage of some $10 billion in the National Assembly.
We are in the relief phase of this operation. It is expected that following the relief phase, we'll have a recovery phase. And what we are doing here is asking for this money because we are assessing out and we're planning for the recovery phase, and we know that there will be an expenditure to repair. I don't want to go into the weeds, Mr. Speaker, but there will be an expenditure to continue to provide food hampers for the people who are affected. There are expenditure related to repair to roads that are affected, a lot of drainage and irrigation related work.
The work of the CDC has been complemented by the generous efforts of the private sector and the foreign organizations. The private sector has donated millions in cash and the cleaning and the food supplies.
They've gone above and beyond in reaching to our demands. And as we continue to ask for more resources on our needs list, the private sector have always been on board in trying to get donors to reach out to us. And so far, that response has been great.
Meanwhile, a new building is being constructed in the compound of a CDC headquarters on Thomas Lands. The building is expected to be completed by August. It will expand the operations of the CDC to better respond to reports of disasters.